We love this next lady. You met this lady here at the April 15th event. You may remember her. She has that funny little accent, the brogue. She has that Irish brogue. Hey, of all the emails that we received after that event, she came in a very tight second to, we got a lot of emails that loved that we said a prayer, and folks just love that, but then they mentioned this Irish lady, and we just got all these emails about the Irish lady. Well, Tara's back here to speak to us again, and we just are so thankful that you're here. Thank you.
Thank you. Would it be a 4th of July without any rain? No. Hi, my name is Tara DeStock, and I've been asked to speak about how would I compare my life when I lived in Europe, which has a lot of socialism, and how I believe my life has improved by living here in the United States, a country built on capitalism. My husband and I were born and raised in Ireland, and about 20 years ago, we moved to England for better career opportunities. We lived there for 4 years, but we were never able to save enough towards a down payment of a home. In our 4 years there, the lenders had these requirements that asked people to make a down payment. But we're now living in enlightened times where these rules no longer apply, and we're all paying the price for all of that government intervention. Taxation in Ireland and Europe overall is higher. Ireland has a 25% value-added tax. The national sales tax, when you buy a home, you'll pay an additional 7% tax. They have a 4% health tax. And I don't want to give non-representing representatives any ideas, but before cable TV, you even had to buy a license for every television in your house every year. And the list goes on. Why is such heavy taxation required? And I'm not just talking income taxes. Somebody has to pay for all the spending, all the benefits, and all the entitlements. When we lived in the United Kingdom, I witnessed firsthand a classic nanny state entitlement. We knew a young man, and he and his girlfriend had 2 children together. She, as an unmarried mother, was entitled to free housing, and it was a beautiful 2-bedroom apartment, far nicer than the 1-bedroom we had to pay for. She was entitled to food, utilities, and a children's allowance. He couldn't find a job, so he was entitled to unemployment assistance, but it didn't stop him from finding a job where he was paid directly cash into his hand. This couple, with no documented income, had a higher standard of living than we did, and we both worked full-time. We asked him once, why wouldn't he get a real job? And his attitude was, why should I? What kind of attitude do you think the next generation will have when they're old enough to join the workforce? And then there are the benefits offered. Nationalized healthcare. It's part of the national debate at the moment, but they don't seem to want our input. For me, nationalized healthcare could be summed up in 2 words: waiting list. And I touched briefly on this last April, but I want to give you some real specifics. I have a brother that needed to see a back specialist and was told he'd wait 13 months. Do you know how long it took my husband to see a back specialist here? 2 days. I have another friend and their son needs to see a family psychologist. They will wait nearly a year for an appointment, and this is a family in crisis. And then I have another friend with an elderly relative who needs a hip replacement. He was told his wait would be 2 years, so they went ahead and paid for it privately. Then if you need some testing done, guess what may lie ahead of you? Another wait, and for a couple of reasons. The first being the obvious, there's so many people ahead of you on the list. And the second, more tragically, is that they may have broken equipment. I have another brother who was in a very serious road accident, and a result of head trauma needed a CAT scan. They had to put him in another ambulance and send him to a hospital 100 miles away because the one at that hospital had broken down. But if you're lucky enough to get the appointment and get the test and you need to stay in hospital, what do you think you might face yet again? Another wait. And again, for one of several reasons. The obvious, so many people ahead of you, you have to take your turn. Or more ironically, where they're closing rooms in the hospital because they either don't have the funding to staff them with medical personnel, or the medical personnel do not want to work under these conditions and have chosen to work abroad like they have done in my hometown. Hey, but if you do get that bed in the hospital, you may share the room with a dozen people and the bathroom's down the hall. Now, when I lived in the United Kingdom, here's how it worked to see a doctor. You went to the office, you signed in, you waited your turn, there was no making an appointment, there was no specifying the doctor, and if you got out in under 3 hours, you were doing well. Kind of like going to the DMV, but hey, that's government run too. And my husband got some dental work done there. Do you know what an American dentist said when he first examined his teeth? And this is a direct quote. He said, "Who butchered your teeth?" So people say, but it's free. Well, really? And what price are people paying as they wait in all these endless lines? Because for me, I think there's two realities to nationalized healthcare. The first is there's only a fixed number of medical personnel and facilities, and an infinite number of people requiring testing and procedures and appointments. And the second, if you pay less for medical care, you'll probably receive less medical care. Now, people could say, but that's not going to happen here. Well, we do already have a form of medical care in this country. Our veterans have used it, and it's the VA system, characterized many times by long lines, aging facilities, poor funding, and we all recall the Walter Reed Hospital scandal a few years back. I recently read an article where over 10,000 veterans had been exposed to the AIDS virus, and nearly 100 veterans had had botched radiation treatments for their cancer. Now I ask you, if our government cannot properly take care of our veterans who have put their lives on the line for the safety and security of this country, how well do you think they're going to take care of the rest of us? I'm happy with the relationships I have with my doctors, and I don't want any government bureaucrat getting in the way with their rationalized healthcare to what we experienced in Europe. So about 15 years ago, we'd had enough of the heavy taxation, and like so many before us, we took a chance and came here to the United States, legally. We didn't ask the government for any assistance, any benefits. We came here in search of opportunities and not a free ride. And in 2 years, we had achieved part of that great American dream when we purchased our first home. I believe in American capitalism and not European-style socialism. We love the United States and are privileged to become citizens. Our 3 boys were born here. We find the American people to be warm and friendly. We haven't found Americans to be arrogant or dismissive. We're puzzled why any American would feel the need to bow down before others. And we, the people, have no need to apologize for being Americans. Washington should hear that more often. Oh, speaking of Washington, we did try to rent some teleprompters, but Washington, D.C., they still have them all. Sorry.